So I came from the perspective of living in Miami, which has a very diverse population with a significant number of Afro-Caribbean women and African Americans. And so on the most basic level, I have these patients who talk to me and have questions about their cancer, and we don't understand, and I can't provide them the data because unfortunately women of African descent have been either excluded or not included in a lot of the clinical research that has been done in the field of cancer across a number of disease sites. We often say global is local and local is global. So what we can learn from our colleagues in Nigeria will help us back in the US, and what we can bring in terms of expertise will also help women here in Nigeria. I've had a long-standing collaboration with the International Gynecologic Cancer Society, and I serve on their global fellowship program. And so what we've done since 2018 is develop these international training programs in gynecologic cancer. And so we have several trainees here in Nigeria who participate in what we call tumor boards. So these are monthly meetings to discuss challenging cases. We use it as an educational tool. I've come to Nigeria several times to do surgical teaching. We're actually in the operating theater yesterday, treating a patient with cervical cancer. And so it's this kind of bidirectionality that's really going to allow us to enhance clinical care here, but also to better understand disease pathogenesis, some of the genetic drivers of disease, so that, as Prof. Bala had mentioned, identify very early on where we can intervene to either prevent disease or to find it when it's still very early.